Welcome to Dateline Health. This is Fred Lippman coming to you from the Alan B. Levan Innovation Center, which is a combined effort between Nova Southeastern University and Broward County Commission. And I want to welcome someone who I've been wanting to get onto this program for a long time. Unfortunately, and I say it unfortunately, because maybe that's my look at it. We have a lot of illness, accidental, and age-related death. And we sometimes, including myself, don't know how to grieve or how to deal with it. The leadership is the founding CEO of Rainbow, and that's Abby Mosher. So Abby, welcome.
Thank you so much. Our organization is Tomorrow's Rainbow, and we are located in Coconut Creek, Florida.
Coconut Creek.
Coconut Creek.
Well, tell us what, I mean, not to get too far into your life, but what prompted you to create Tomorrow's Rainbow?
Well, we actually just celebrated our 18-year anniversary, but the reason that I actually founded Tomorrow's Rainbow was through my own personal tragedy. My family, my husband and my 7-year-old son and I were on vacation in Texas, and we were involved in a head-on collision at 65 miles an hour, which killed my husband instantly and left my son Dustin and I both hospitalized. And when we came back from Texas, I wanted to do whatever I could to help my son and I heal from the tragedy. And what I didn't realize is that there were no resources available other than individual therapy, which I had available because my husband had great insurance benefits. But the social isolation for my son was really devastating. And so I wanted to make sure that there would be a place for kids to be with other kids that knew what it was like to have somebody important in their life die. And because we're in Florida, and I believe in the therapeutic benefit of horses, I wanted it to be outdoors with horses.
Uh, what services do you, I mean, you generally have stated it, but what services do you provide? I mean, the people out here have asked a number of questions. We're in our 26th year of being on television. Well over 600 programs. But it's amazing because a lot of folks who write to us just very carefully offer questions about where do I go to grieve? That's the words that they use. So knowing of Tomorrow's Rainbow, I said to my executive director, let's try to find out whether we can get you to come on, because I think the people out there are asking questions and I've never given them an opportunity to hear you. So what services do you provide?
Well, I'm so grateful for the opportunity to come on and share about what we do at Tomorrow's Rainbow. We actually have 3 programs. Our first program is peer support groups for children ages 3 to 18 who've experienced the death of somebody important in their life. And we do that through peer support groups, miniature horse interactions, and therapeutic art and play. And while the children are in their support group, we have a simultaneous adult support group as well. So we want to make sure that we provide emotional support for the entire family. One of the challenges that we have, though, is that some people have trauma in addition to their grief. And so children that come to us that have actually experienced trauma, as well as having somebody in their life die, we can provide individual equine assisted psychotherapy for those children. And then finally, although our program is at no cost, transportation can still be a barrier. So one of the things that we want to make sure is that we're able to get out into the community and to underserved areas and provide our services. So we have 2 mobile programs, the Tomorrow's Rainbow Grief on the Go and Tomorrow's Rainbow Coping Academy. And we take the horses and our team into underserved communities to support their mental health as well.
You literally take the horses to the community, or the people come to where the horses are?
We do. We actually take the horses. Well, we have a community partner, so we will go to a location that has been determined by our community partner, and then so it might be a school for underserved children. We go to Broward County Juvenile Detention Center. We go to other locations, and they have the children there that we can work with. Children that have experienced grief, loss, adversity.
Uh, since we're in this area of discussion, tell me about your collaboration with the Leadership Broward group.
So that has been such a wonderful collaboration. One of the things that we did, we were fortunate to have funding to be able to bring our mobile program into Southern Palm Beach County, but we didn't have any partners in Broward County, and we knew that there were children that were suffering in Broward County as well. So we wanted to expand our mobile programs into Broward County. Our Leadership Broward project gave us the ability to do that. We identified partners, we identified funders, we did some marketing work, including our horse trailer being able to be customized so that we could efficiently take the program on the road and have it wrapped so that while we were on the road, people knew who we were and what we were doing. And then finally, one of the things that we really needed to do was recruit the volunteers that would be able to help us with that effort. And so the Leadership Broward Project was really comprehensive about making sure that the mobile programs had a footprint in Broward County as well.
Uh, I guess this is a sort of a technical question, but who obviously, it's obvious as to, in my mind, who is eligible, but I want you to offer your comments about who is eligible and how do they reach you?
Right. So we look to partner with anybody that is working with at-risk youth and underserved, under-resourced communities. And in particular is those that are suffering with grief or adversity. And if we identify a partner, then we can go in with our team. And the best way to partner with us is to reach out to me directly. You can find us on tomorrowsrainbow.org, and we can talk about what that partnership would look like, how often, what the population is that we're working with, and how we can work together to bring those children and teens that are suffering from grief and loss, how we can bring them towards resilience and joy.
You know, uh, I'm going to relate to one word that you just stated in your comments. What is considered to be underserved?
Right. So those are children where there would either be a transportation barrier or a financial barrier. So those areas in our community that really are a mental health desert, where those children don't have the resources to have their emotional wellness supported. We have through our on-site programs that are still at no cost, because we don't want families who are coping with the death of a loved one to worry about financially how they're going to pay for mental health support. So our on-site services are able to support those families. But when we're talking about those pockets of our community where it really is literally a mental health desert, where there aren't resources available, whether it's a financial barrier or a transportation barrier, we want to make sure that those children still get the services that they need for emotional wellness.
Well, if I'm not mistaken, I think in reading some of the information that I had about Tomorrow's Rainbow, you have a mobile mental health unit, correct?
Well, our mobile program is our Grief on the Go and the Coping Academy. We do not provide individual psychotherapy on the road. We provide therapeutic interventions with horses, and as well as a clinician and talk circle and safe spaces and conversations and coping skills and problem solving. But we don't provide individual one-on-one therapy on the road. That is at our site in Coconut Creek, Florida.
Tell us where that site is in Coconut Creek, Florida.
We are right outside of Tradewinds Park. We're off of Wiles and Lyons Road, and we have a wonderful herd of 16 horses that are available in all shapes and sizes and stories and personalities. And our team is certified by EGALA and Equine Assisted Psychotherapy. So when you come for individual therapy at Tomorrow's Rainbow, you actually have a team of a master's level clinician, an equine specialist, and of course our four-legged counselors as well. I will tell you that we do have many families that come to us because their loved one has either died from a car accident or a motorcycle accident. In my case, airbags did deploy. It was just we were hit head on at 65 miles an hour, so I don't think that anything could have saved us there. But I think that it's really important that no matter how safe we make our vehicles, that we need to make sure that we also provide that safety when a tragedy happens. And so when families do have an accident that it involves a fatality, that in the aftermath that they don't get lost and that their emotional health is still supported long after the physical injuries are healed. And so I wish that I had the answer for making vehicles safer. I certainly would have loved my story to play out in a different manner. Although I will say that through my story, through my tragedy, I was able to create Tomorrow's Rainbow and support children who are grieving a loved one, not only from car accidents, but from suicides and homicides and substance abuse and illnesses. And so I wish that vehicles were certainly safer. I wish that nobody needed Tomorrow's Rainbow, but while it's necessary, I want to make sure that families have a safe place to go to and that they know about us, which is why I'm so grateful for this opportunity to have a voice and let families know we're here for you and we're here to support you.
That's very important. And actually, I'm going to want to ask you relative to that. I would assume that there are individuals out there that would like to volunteer to help. So tell me about that.
We would not even exist without our volunteers. So I have to say they are such a special and important part of our program. Volunteers can begin at 16 years old, and we have different volunteer roles. So a program facilitator is actually trained in how to work with the children in a peer support setting, although we have clinicians that oversee the program as well. We have volunteers that are stable attendants that help us to take care of the horses. They are big and small. We have volunteers that help at our events. We have two signature events a year. One is Hope Floats and one is Pony Jail and Bail. And you can find out more about those on our website, but those take a ton of volunteers. So we have even the volunteers that we have for our mobile program, which is what we're really recruiting now, because it takes a lot of resources to be able to take two miniature horses and four different stations into communities and provide those services in a really well-timed, fine-oiled machine. So we have many volunteer opportunities available. We also have community groups that come out, which is wonderful because then we can get a project done from beginning to end with that many man hours focusing on it. So there are a ton of volunteer opportunities, and we're so grateful for any individual or group that comes out and volunteers with us.
There are multiple organizations that offer themselves to the community for various, what I would call community and help and community enhancement.
Yeah, over 18 years, we've had a lot of corporate and civic groups come out to help us. Of course, we love that. And I will tell you that we have hosted the NSU Sharks several times at Tomorrow's Rainbow for projects, and they are some hard workers. So we would welcome them back anytime.
They really seek out the opportunity to be helpful in the community. So I would just suggest to you that it might be a good boost. Again, even though you're getting some help.
I'd be so grateful for that, especially our events that take a lot of manpower to set up, to tear down, and then to run. But also those other talents that people have that they would be willing to share with us. So whether it's in marketing or mental health, or whether or not you just want to come out and help us keep 16 horses healthy and happy, we have something for everybody.
Well, I'm really, this is a difficult area that I'm about to talk about, but you led me right into it. Mental health, all right? Just within the last period of time, there's been a report that has come out, which was a 5-year study of teenagers, pre-teenagers, and I would say just post-teenagers. The number of suicides that have elevated, particularly as I read it, and this is just as I read it, but it's not necessarily just females. But the thing that struck me is that it's the highest number of suicides in females in the history of our country. And it was like a 5-year study. And I've got to believe that there must be some place, somewhere in our society, like rainbows, that would be directly involved in preventing some of these suicides. What do you think?
Absolutely. We are in a mental health crisis, and supporting the mental health of everybody, but our youth as well, is so critical. We, as you know, in the aftermath of COVID, certainly the mental health crisis has become even more significant. We continue to grow and add staff as quickly as we can, but even in doing that, we have a wait list for individual therapy. We screen all of our children and teens that come through our program to make sure that there's no suicidality, and we make sure that if there is, that we get them the individual mental health services that they need in order to heal. And it's something though that I think the entire community needs to continue to educate itself on, and to be there for people instead of going, oh, well, it's probably nothing. We should just always err on the side of caution and make sure that we do everything within our power to keep our fellow mankind safe. And that means asking the tough questions and being insistent on guiding people towards help whenever possible.
You know, you hit on this COVID issue, and I'm going to throw it in here because I think it's very important. You know, often, you just spoke about teenagers, all right, particularly females, but yet there are a lot of stresses that are placed upon that particular period of time. They're getting a change in their own physical being. And then you have the issue of going on to an occupation or to a college education or whatever it is. There's a lot of stress. And then they're part of a family where COVID is hit dramatically. And we have this long, extended COVID crisis, I believe. Maybe I don't want to call it a crisis, but it's a reality. There are many, many people that are still suffering, and many of the doctors that I've spoken to, they said that a lot of it has to do with the way people handle their lives. That means mental health. So tell me, I know that it's a little bit beyond perhaps rainbow, but if not, tell me I'm wrong.
Well, mental health is something that everybody should be paying attention to. And even, we take the children to the doctor for their physical checkups and their shots. And, we go to the doctor when we're not feeling well, but we don't go and seek professional help as often or as readily when our brains are hurting, when our minds are hurting. And we need to make sure that we continue to remove that social stigma attached with mental health, so that it's something that we all do. We teach everything in school, but we forget to teach coping skills, and we forget to teach what it feels like when you confront and overcome a problem, and then you celebrate that. And so mental health is, I wish that it was just a 1 + 2 equals 3 kind of question, but it's not. It's something that needs the attention that we give our physical bodies. We need to give our brains, the support as well. And I think that the best way to do that is by continuing to open up conversation and to remove the stigma when people just casually say, I'm going to my therapist today. That's wonderful. We don't hesitate to say, oh, I've got to see my doctor today. I got to go get blood work. Well, we need to get our brains the same attention that we're giving our bodies so that we can have those healthy, resilient futures. Certainly in the aftermath of COVID, with the social isolation, and definitely with children who didn't have that socialization necessary to get the feedback and the responses and to overcome those struggles of what it's like to build new relationships and to encounter those social situations that might not all be easy. As we removed our youth from being with those people that were so important in influencing their lives, climbing out of that has been a real challenge, and it's a problem for all of us to pay attention to, and it's something that we need to remove the stigma from, so that we make sure that our children grow up to be healthy, happy, productive members of society.
Well, that's the reason why we had you on as a guest today, because of your last paragraph. I personally want to thank you for not only your advocacy and your creating the Tomorrow's Rainbow, but I really want to say on behalf of myself and the viewers that you're not only a blessing to the people of our community and the arranged community that you provide your services, but it's good to have someone as kind as you to bring to the sorrow of individuals and direct them onto what I would call the right street or the right track. And I want to thank you very much for your time today, because again, we usually do healthcare shows per se, but I think that this is a healthcare issue, and we have a mental health, in quotes, crisis that we are having difficulty dealing with. So I want to thank you, Abby Mosher. Thank you very, very much. And thank you for being the founding CEO of Tomorrow's Rainbow.
Thank you so much for inviting me. It was such a pleasure to have the opportunity to speak with you.
Thank you. Folks, if you have any questions, we're going to put up the telephone numbers, how to get in touch with you, et cetera, et cetera. I'll speak to our executive director who will get that done, and we'll put it on the screen. People want to talk to you, or people want to support you, or otherwise they'll have an address or a phone number so they can be in touch with you. How about that? Remember, this show is called Dateline Health. We come to you from Nova Southeastern University, and my name is Fred Lippman. Until next time, see you.